pull up my slide. Hopefully you're able to see something useful.
Yeah, we see.
Okay, great. Um, as Carlos said, I'm Carl Leitner, and I operate the Global Digital Health Certification Network and have been a part of the supporting the Roxelle project for a number of years. So today I just wanted to talk a little bit about what the GDHCN, how it works, what do we use it for, and then look at some specific use cases around the digital vaccine cards or the International Certificate of Vaccine or Prophylaxis, as well as the International Patient Summary. Talk through some of the benefits about participating and some information about how to onboard to the network. We're not going to go into full details on that last bit. There's some technical details. There will be a follow-up webinar on this, but just to give you some sense of the overview of what's in there. So first of all, what are we doing with the GDHCN and why are we doing it? One thing is that we want to move to more person-centered health systems. So I think the current state is that you go to the a clinician or a doctor or a nurse, and they have your health records. They provide you care, they update those records, and you go home. But we want to change that dynamic a little bit where not only were you able to go home with your own health records, that you can go and and as you visit a doctor, bring your health records with them. So this is important for international travel, maybe regional migration, but it's also just um, something where we want to ensure that people have access to their own health information. As you know, there are several countries where the rights of individuals and citizens are sometimes not fully there, and we want to ensure that the individual's right to health is not taken away. So as part of that, we really want to ensure that a person can travel with their health records with them and seek care wherever they choose to seek care. But as they do that, we need to make sure that those records are verifiable. And the Global Digital Health Certification Network is one method for being able to trust health records. So a little bit about the origin of this is that it came out of the COVID-19 pandemic. If you'll remember, there are a number of QR codes for both your vaccination status as well as your test result status for COVID. And WHO published some guidance on that, on how digital systems can be used in an equitable way to provide this type of health record. We have reference software, and it's aligned with uh, the various implementations of the COVID certificates across countries, but there's a lot of interoperability issues and a lot of trust issues. Some networks couldn't trust others; they just didn't operate in the same way. And so, in the basis of that, WHO really tried to pull together comprehensive information on a global approach rather than regional approaches for this type of verifiable health documents. And so, if we looked at all of the systems that were in place, we had the EU, the digital COVID certificate, which I think many of you had an equivalence decision for. There was an ICAO, the International Civil Aviation Organization. There's something called DIVOC coming out of India. In the US, there was, in Canada and Japan, there was smart health cards. They're all sort of the same information, but not quite. Didn't fully interoperate, and the way that they established trust and verified documents was quite different. And so there was a need to federate across these and ensure interoperability, and that was the basis for the Global Digital Health Certification Network, which was launched in June of 2023. So we took up a lot of the standards, the software, which is open source. The standards are open as well from the EUDCC, the Digital COVID Certificate Network, and expanded that. So we made a clear separation of the contents, the types of things that can be verified, whether it's a digital vaccine certificate or an IPS, as we'll talk about later, from the actual trust network and how it operates the public key infrastructure. A circular was sent from the Director General of WHO for member states to join in September of 2023, and a number of you have already joined using the equivalence decision from the EU or in the process of joining. And simply put, the GDHCN is a way for member states to verify a health document has been securely issued from another member state, so that they can trust the provenance of that document. So I can't come and say, oh, here's a health document from Ecuador, and believe me, it's really the health document from Ecuador, and when I travel to Brazil, and Brazil not having a way to actually verify that document and believe and trust me. So what we have done is to ensure that there are cryptographic methods so that if I travel from Ecuador with my health record to Brazil, that record can be verified, and the clinician, the doctor doesn't need to look at me and decide if they can trust whether I'm providing an accurate health document. You know, there are reasons to falsify documents that could be for insurance reasons. It could be for vaccination status, claiming vaccines that you don't have. Could also be medications, you know, particularly things like opioids or other potential medications that can be abused. So we do need to have trust in these documents. So how it works is a sort of three-step process. The first is WHO establishes trust with the member state. So a member state comes to WHO and says, we'd like to join the GDHCN. And WHO verifies that the person or purporting to be that member state is really representing that member state. We go through the process of establishing organizational identity, conclude a passport check or other diplomatic channels to ensure that that WHO is really speaking to the appropriate authority within the member state that could provide the keys. So in that first step, we establish trust, and WHO works as a trust anchor for participants. And then a participant would send the keys that they have to use for cryptographic verification of digital signatures. And then in step two, WHO will distribute those keys to all members of the trust network. We actually distribute those publicly to anybody, but in particular, it's available for the countries A, B, and C that might have joined. At this point in the process, WHO is no longer involved. Keys have been shared and distributed to all member states. And an individual in step three is now traveling from, let's say, country A to country B to country C, and bringing health documents that they want to verify the provenance of. And so at this point, since country B has received all of the keys from country A back in step two, um, country B can verify directly the validity of that document that the individual from country A traveled with without actually having to go back to WHO. So WHO does not see any of the health information in that document. WHO doesn't even know that that health document was even being verified by country B, has no access to the personal information or any knowledge of how that information has been accessed or used. Essentially, WHO is providing a very sophisticated phone book of all of the public keys for the participants and shares that out to the countries. WHO does not operate the phone lines. It does not make the phone calls. It's just providing that fancy, sophisticated phone book. So once we have this, the public key material, you can do a lot of different things, and we'll see a few examples of this. But the first thing that you can do is sign a document, and this could be a PDF document, this could be a JSON or XML, sort of a health document, and there's standardized ways of signing the documents. There's an IHE profile called DSIG-J, for example, that shows you how to sign XML and JSON documents, which you typically see in standards such as HL7 FHIR. So once we have your keys shared, you can sign these documents, and another country can verify that the digital signature is correct and verify the authenticity of that document. Um, we can do more sophisticated. Oh, sorry. This shows a more technical overview of the workflow for sharing the keys and synchronizing them on the left-hand side, and then verifying a digital health certificate on the right-hand side. So the left-hand side was just a different view of what we just looked at, where a country A is generating keys, sharing them to WHO as the trust network anchor, and then a second country, trust network participant B, retrieves those keys for verification. On the right-hand side, you can see a uh, where a a digital health certificate is being requested by an individual and issued by a country and then provided um, to a verifier application that can be used to verify that application. But I want to focus in on sort of this requesting a verifiable digital health certificate and its issuance, and break that workflow up a little bit more, so you can see how that gets pulled together. So first of all, um, just to skip ahead, one of the things that is very important as we make health documents available is sort of consent and selective disclosure. So one of the things that we've built into sort of the workflows and um, uh, sort of expected behavior is that if an individual is requesting their health document digitally, that they go through a consent selection to validate that they are agreeing to share that health document with somebody. There's an IHE profile called PCF, or the Privacy Consent Framework, that you can see in the upper half of this diagram, that shows how to actually record consent, and have it in the system. So there's clear um, directive to share that information. In the lower part, you can see a slightly different view where we've gone through the consent selection, and we want to handle selective disclosure. So selective disclosure would say if you have a health document, you may want to share not necessarily all of that information um, within the health document to somebody, but selectively disclose only certain bits of information. So there's different ways of doing selective disclosure, but they're very important um, for the privacy of the individual. However, some of those ways are more complicated than others, and we're still going through a process together with you all of trying to figure out what are pragmatic ways to handle selective disclosure so we can really ensure the individuals' privacy and rights to their health data and their rights to share the health data with whoever they want. Um, the all of these sort of types of health documents are brought together under the notion of a trust domain. A trust domain is a set of use cases and that describe the sharing and utilization of a verifiable digital health certificate or health document. Then there's the technical specifications that underline how to share that data and what that health content is. And then policy and regulatory standards that uh, apply to the use case and affect how um, it gets operationalized. On the right-hand side, you can see some examples of types of trust domains. The COVID-19 certificates that we're all familiar with, that is one trust domain. It was which is operating during the pandemic emergency. We see other types of potential trust domains like childhood immunization records, health worker credentials, maybe from a doctor or nursing council, the international health regulations, which we'll come back to in a second, the international patient summary, which we'll also see, e-prescriptions, and lots more. So essentially, the WHO's Global Digital Health Certification Network is a digital public infrastructure that enables you all to establish use cases and share information and utilize the infrastructure for verification of those health documents. So whatever you feel is a priority for you all, through the Pan American Highway for Digital Health as one trust domain. We will work with you to ensure that you can um, share any health certificates that you choose to. Um, so really what we're talking about is, oh, yes. So really what we're talking about is a personal health wallet a digital wallet that an individual has, and they put different types of content into that wallet. Um, for example, on the lower left-hand side, there's a Hajj health card. So this is for pilgrims going to Mecca and Medina for the Hajj pilgrimage. So that's happening right now. As we speak, the Hajj is happening, and pilgrims from 3 countries are using the International Patient Summary and the Global Digital Certification Network to bring their records with them. Last year, we had over 250,000 instances of the Hajj Health Card or IPS that were created for use in Saudi Arabia. Another example was the ICVP or Yellow Card or Yellow Book. We'll talk about this in a minute, but more specifically, more generally, we have a maternal child immunization card as well as other cards. And so if an individual puts this on their wallet, and they share that as they seek care or travel, how does that get verified? And that's through the GDHCN. So I want to focus a little bit on the digital ICVP, the International Certificate of Vaccination and Prophylaxis. So this is a new trust domain that we are standing up. It's based on the passage to the amendments of the international health regulations last year, and the implementation of the international health regulations will begin in September. In in advance of that, we're working on technical specifications as a HL7 Fire implementation guide that describes how to digitize the ICVP or Yellow Book. Prior to the amendments, there was only a paper version that was legally allowed, and you can see in bold the changes that were made to some of the text of the international health regulations, which includes, for example, the digital and non-digital formats, and allows for uh, instead of a physical signature by clinician, we can utilize the Global Digital Health Certification Network for the verification or through a digital signature. Um, what we want to do is ensure that there's equity for these ICVPs, that the digital versions of them, so that particularly for people that don't have smartphones, that they have options to have computable or digitized vaccine records, but perhaps on a printed QR code, but still have access to that without a smartphone. The scope of the ICVP is limited to yellow fever, polio, and any potential emergent threats. I think Ebola is one of the vaccines that's an emergency use listing. It's not for all vaccines. We understand, though, that the infrastructure and the use of the paper yellow book in the past has included other vaccines. So the way that we're approaching this is to make sure that the standards, the infrastructure can support vaccines beyond yellow fever and polio, but and have a general digital vaccine certificate. And I believe that that's what you're planning for and testing this year. The ICVP will be limited to yellow fever and polio. We want to ensure that openness, so fully open standards. We're working on white labeled verification apps that will be fully open source. And we need practical solutions. So as I mentioned, in September 2025, implementation begins. And we need to have something that is suitable for this time frame. And obviously interoperability. I mean, I don't think any of us are here unless we're worried about interoperability. But in particular, we know that there are national and regional vaccine initiatives, and we want to ensure that those initiatives, any digital vaccine cards that get produced, are compatible with the ICVP. So we have some tooling and some requirements to ensure that that is the case uh, for these other types of vaccine certificates. Um, just to highlight, there's very few sort of business rules around the vaccines for yellow fever and polio in the international health regulations. They're basically saying the only one is that yellow fever is valid 10 days after the date of vaccination. So we'll make sure that that is included in the sort of the business rules and the validity for checking the validity of the the digital ICVP. But overall, it should be relatively straightforward and similar to the process that people go through now, just a digital version. Um, and um, maybe just skipping ahead, you can see that we're working on logical models and other FHIR implementation artifacts to help facilitate the digital representation of the ICVP, including structure maps to and from the International Patient Summary, which is a broader set of health information, and we'll come to in a minute. Um, and that minute is here. So, how can so looking more broadly from just very specific yellow fever and polio vaccines, there's something called the International Patient Summary, which is another type of health document. It's a broader document that's used for unplanned care when traveling. That could be generally traveling abroad, but also within a country. So if you don't have a national um, uh, health information system or national shared health record or patient portal, um, you can use the IPS within a country as you travel around, but within a country and show your health information. Regionally, we saw already, we discussed the Hodge use case. And for the Pan American Digital Health Routes, the PH4H, the IPS will be one of the key documents. And you can see in the bottom some of the key areas or sections of the IPS. The red are the required ones, which are medication summary, allergies and tolerances, and problem lists. Orange are recommended, and the green are optional. This is sort of the starting points, and it's up to you to describe how exactly you want to use the IPS. What are your key priorities? Um, and to ensure that sort of the required and recommended option sections are there. We discussed the Hodge already, but I just wanted to give an example of how the Hodge as an IPS is used by a pilgrim. So here is a national portal or national health portal, My Sejahtera, which individuals in Malaysia use in general. It's not Hodge specific. This is just their health portal. And in their health portal, they have a section called the Hodge Health Record, which they can go into and configure access to the International Patient Summary for use during Hodge. And you can see in the sort of screenshot on the right, a view of what that Hodge health record looks like. It's just the International Patient Summary. Right now, we're focused on unplanned care with pilgrim consent. So when they let's say they arrive to an EM hospital or clinic, they show their QR code for the Hodge health record. Showing of that code is their consent, the physical showing of consent, at least in this first phase. In the future phase, we want to ensure that we have consent directives. So if a person shows up that is not conscious, that they can still, the clinician can still access that health record in an emergency sort of break the glass scenario. And so we will continue to expand the uses of the IPS and different consent frameworks. Um, so I think just to summarize sort of some of the benefits of participating in the GDHCN, individuals have access to their own health data in a secure manner, ensuring continuity and quality of care. And that it allows individuals to travel abroad and have health documents that are verified. And those can be used for both international as well as domestic verification. This also, in addition to the continuity of care, this is really also supporting pandemic and epidemic preparedness through digital public infrastructure. We hope that epidemic or pandemic like COVID won't happen again. But if it does, we will have the infrastructure to be prepared this time. So that's given a bit of an overview of what the GDHCN and is and why we're trying to do it. And now, how do we join or how do you onboard onto the GDHCN? So the the first thing that you do, or sort of at a political level, is that you send a letter of application to WHO saying that you would like to join. And right now we have 81 participants that are in the process of joining or have already joined. The green are those that are joining or have joined and are fully in production. And we want to support you both through the Roxel Connectathon and through support, or support in general to join. Um, so what type of support do we have? We have lots of online documentation, and we'll see a little bit of that next week. There is a webinar next week to go through some of the technical details on onboarding, how to set up key material, how to share that with WHO. We also have dedicated technical support if needed. So if the webinar and the online documentation isn't sufficient, we can arrange to have a call with your teams and your team and our technical teams to ensure that you can go through all of the necessary technical details and ask any questions that you have to have confidence in what you're doing. So where's this online documentation? It's smart.who.in/trust. That's where this should be your starting point. And here you can see a few things on this webpage. First, if you go to the navigation bar under deployment and onboarding checklist, you'll see basically all the steps that you need to go through to onboard and start sharing your key material or public keys with WHO and making them available to other participants. You'll see a link to the onboarding process, as well as the GDHCN administrative and operational framework, which describes the operation and governance of the GDHCN in general. Going into the onboarding checklist, you'll see an overview of the process, the technical process for onboarding, which essentially you'll set up a local repository of your key material in a Git repository. You generate a GPG key to protect that material, share that with WHO, and start generating your certificates into the local repository. That local repository is shared with WHO, and WHO will watch that repository anytime you have key material that you want to upload into it. We watch it, and then we sign it and verify that that is your key material. Once we've done our co-signing of your key material, we share it out to the trust network, all the other participants, and it's now available for verification. So you can see this is the technical process, but the political process is really initiated from that letter of application. And that's sort of the last step that we validate is there before we go into production. You can start in dev and UAT environments, user acceptance testing environments to go through this onboarding process without a formal letter of application, but to go into production, to go live, we do need that letter of application sent through a diplomatic channel or through individual, physical meeting with a passport verification. If you go to that same page on the onboarding checklist, it goes through, and I won't go in detail today, but it goes through all the steps that you need to do. It has a list of all of the commands that you need to run to start to generate your GPG keys, your GitHub repository to share that um, to WHO, how to generate certificates, and there's also videos that go through each of the steps. Unfortunately, right now the language is only in English and it hasn't been translated yet. But just last week, HL7 just announced new multilingual support for the FHIR implementation guides, which now will let us um, um, uh, have Spanish or Portuguese language versions of this onboarding process. So please be patient with us. It will get there over the next few months. As you go through that onboarding process, you want to make sure that you are going through it successfully, and we have a number of test cases set up that you can use to sort of verify each step of the way that what you're doing is correct. So you can see some example test cases around recording consent as a larger overall process, issuing a verifiable health link or QR code to access an IPS, or how to verify a signature on a QR code that you received. And so this testing infrastructure we are building out with Rexel and will be available for sandbox or pre-Connectathon testing um, in the next month, and will also be a part of the peer-to-peer testing during the Connectathon that will happen later this year. So I'll stop here, but I just wanted to share a few more links on where to get more information. If you have any questions on the political process or just on the GDHCN in general, you can use the GDHCN Secretariat email. If you have technical support questions, really getting down into, for example, which type of keys, how the keys are generated, can we use elliptic curves, what level of curve do we need? We also have a support email, GDHCN support@who.in for more technical questions. So with that, I'll end and happy to answer any questions. Thank you.
Thank you very much, Carl. Gracias, Carl. ¿Preguntas? ¿Alguna duda? Es el momento. Una pregunta, algún comentario, ya sea con el mismo marco de confianza, con el proceso de onboarding. Me parece que no. Quedó todo claro. No veo tampoco en el chat. Bien, solo recordarles que la sesión próxima vamos a estar haciendo un poco un doble clic en el proceso onboarding. Yo sí tengo una pregunta. I have a question for you, Carl, regarding the onboarding process. Are we expecting some changes for the onboarding in the dev environment for this year, or the process remain the same than the last year?
The process is going to be the same as last year. We have some new options and new ways to new types of keys this year, which particularly that was set up for things like telemedicine. If you want to establish secure connections, MTLS style connections, but that could be more experimental status this year rather than necessarily something to go into production.
Perfect. So we remain the process, and I suppose that for Conectaton purposes, we're still on the PH4H folder. And okay, perfect.
Yep.
Fernando tiene una pregunta. Adelante, Fernando.
Thank you, Carl. What other type of documents are you considering? First, we understand that we are working with vaccination certificates and IPS. But what are in the future, what do you think other type of documents or certified that could be used in GDHCN? Thank you.
Um, yeah, so right now we see that the two main sort of clinical health documents are the IPS and the vaccine certificates. Um, I mean, there are some examples of other types of health documents, but they don't have so much broad international use. Um, they're more sort of regional use. So, for example, there's the EU vaccine card that's being developed, and so that will likely be deployed through the GDHCN. There's a European patient summary, which is like the international patient summary, but European specific. Um, Outside of those sort of clinical health documents, I think there's a lot of interest, although it's not necessarily um, gotten to a point where it's being operationalized yet, but there is a lot of interest in health worker education. So verifying that, yes, they graduated from an appropriate medical school, for example, or nursing school, particularly when they travel abroad, as well as accreditation and licensure status with a medical council and nursing council. So those are sort of health non-clinical health documents, but health documents nevertheless that we expect to see um, over the over the next year.
Thank you.
I think we have a couple of questions on the chat, Carl.
Mhm.
If you could read from that.
Where can we find the process of each country? So the status of each country. Let me share screen and I'll show you exactly where to do that. Uh, if I can find the share screen button. Um, okay, so hopefully you're seeing my screen share. So we go
Yep.
smart who.int/trust. Under deployment, you had your onboarding checklist. If you keep going down, you'll see endpoints.
Points.
And those endpoints, here, I'll show it again. The very last one, the endpoints. Under endpoints, we have all the list of the trust domains that are available, the types of keys, the list of participants. So you can see all of the participants here and their codes. We can see the endpoints of where you can retrieve all of the keys. So here is the dev environment of keys. Here's a production environment of keys. But you can also see a status monitoring dashboard. So again, we have the dev, user acceptance testing, and prod environments, but you can check for example, the certificate expiry for each of the countries. Here's a dashboard. You can choose your country. You can sort by country. So you could, uh, let's say Belgium. You can see that they have different types of keys that are uploaded. The key ID and the hash of that, and expiration date. So you can get all of the status that you'd need for either yourself or for another country from this dashboard. Adriana, I hope that answered your question. And then there's a question about support. No, it's not just by email. Email is not very efficient, and it's not the best way to communicate. So no. But if you want, we have a set of office hours with routine, I think Mondays and Thursdays with sort of slots where you can sign up for a half an hour um, uh, session or more if you need. And if those times don't work, we can also just do an ad hoc session where we go through and give you the support that you need. But please coordinate that through the GDHCN Secretariat email so that we'll coordinate through the email, but we can communicate through
Yeah, I think
boarding.
I can help in that also because we have the Raxel support. So let me switch to Spanish to answer that. Para el soporte respecto del proceso de onboarding en la GDHCN, nosotros recordar que para la Conectaton estamos trabajando en el ambiente de desarrollo y hay un proceso de soporte y un trabajo que es acompañado con sus monitores respecto de dejar esa llave en el ambiente de desarrollo. Eso nos da, por supuesto, ya lo hicimos el año pasado, este año lo vamos a volver a hacer. La idea es actualizar las llaves en algún momento en esta fase de preconectatón eh, con la intención justamente de actualizar ese conocimiento y que los equipos técnicos de los países, sobre todo si hay equipos nuevos, tengan ese conocimiento lo más actualizado posible. Entonces, un poco en nuestra macro planificación de hitos es una tarea que viene. Vamos a volver a repetir ese proceso. De hecho, el webinar que viene la próxima semana es la explicación de ese proceso para que después lo puedan bajar con sus monitores. Ahora, una vez que eso está listo en ambiente de desarrollo y que nos habilita para la Conectatón de este año, por supuesto que hay que pensar en el paso productivo y ahí recordar que el proceso administrativo lo estamos llevando en conjunto con la OPS. OPS está gestionando las cartas y la formalización de esa solicitud que va formal hacia la OMS para ser parte de la global en ambiente productivo. Y allí ya coordinaremos las necesidades técnicas que hayan al momento de subir a productivo, porque nosotros también podemos proveer con el apoyo de los monitores de Raxel, algo de apoyo técnico desde el equipo de desarrollo también que tenemos para estos 3 años de la ruta en conjunto con lo que nos puede ofrecer OMS, por supuesto, también asociado a ese paso particular, pero eso ya es otro nivel y ya cuando hablamos de productivo. En el corto plazo, que es tener el conocimiento y lograr subir esas llaves para comenzar a trabajar en prueba de concepto, eso lo vamos a gestionar 100% con los equipos que están trabajando de cara al camino hacia la Conectaton. Eso lo tenemos cubierto y cada uno de los países participantes tiene su monitor. Si hay algún presente de algún país que no esté participando activamente en ese camino a la Conectatón, los invitamos a que se comuniquen con nosotros y también los podemos apoyar en ese proceso de ambiente de desarrollo y prueba de concepto para que puedan entender cómo el proceso que no es sencillo, ¿ah? Son algunos pasos bastante complejos y que hay algunas sutilezas respecto de si están generando y subiendo las llaves desde ambiente Linux y Windows, por ejemplo. Nos dimos cuenta nosotros que hay algunos aspectos que hay que tomar en consideración. Eso puedo agregar. ¿Alguna otra duda, consulta? Si no, ya podemos ir cerrando la sesión de hoy. Tenemos algo de información ahora al cierre. Yo creo, Fernando, que te voy a dar la palabra. Primero, déjame. Voy a agradecer nuevamente a Carl. Thank you very much, Carl, for your knowledge and for share this presentation with us today. Of course, it's really valuable for us, and we are going to repeat the process this year in this road to Connectathon around the onboarding process for the keys on the GDHCN. So it's work in progress from now to the upcoming weeks. Thanks again, Carlos. It's always a pleasure. Fernando, en el fondo tenemos información también que entregar asociado a lo que son las conectatones nacionales también y creo que tú tienes el detalle completo, así que por favor, si nos puedes contar eso en estos minutos que quedan.
Sí, muchas gracias. Bueno, gracias también a Carl y excelente la sesión de hoy. Y comentarles que también la próxima semana va a ser una semana muy clave para dos países. Perú va a ser su primera conectatón. Martes y miércoles vamos a estar con el equipo de Raxel y del proyecto de PH4H allá. Van a hacer toda la conectatón relacionada con el RENICE, la primera conectatón que prueba su primera guía de implementación basada en el IPS también, modelando el IPS para Perú. Y el día viernes, la conectatón también de historia clínica y del sistema financiero acá en Bogotá, en Colombia. Entonces, ya les comentaremos y esto pues también para motivarlos a que los otros países eh, también generen sus actividades con sus ecosistemas en ambos países. Van a participar ministerios de salud, la seguridad social, hospitales privados y demás. Y ha sido un proceso que les ha llevado de 2 a 3 meses. Tenemos aquí a José Luis. Si José, ¿nos quieres comentar un poco de la conectación de ustedes en Lima la siguiente semana? Adelante.
Sí, ¿qué tal? ¿Cómo están? Buenas tardes. ¿Me escuchan bien? Perdón. Sí, ok. Gracias, Carlos.
Perfecto.
Sí, gracias, Fernando. Gracias, Alejandra. Gracias, Carlos. Gracias a todo el equipo porque nos están apoyando bastante. Sí, hay una realidad muy particular como cada país en Perú. Necesitamos compartir la historia clínica electrónica en este caso y basado en lo que hemos aprendido en estas conectatones y vamos a seguir avanzando. Es que nosotros empezamos a trabajar ya un concepto que es ese famoso IPS que utilizamos para la región, pues ahora lo hemos personalizado para un IPS Perú. Y hemos armado las guías técnicas y todo lo demás. Este, y vamos a hacer una actividad ahora, pues la próxima semana, ¿no? Ya estamos ahí, esos detalles finales para ya poder realizar esta actividad. Están participando a nivel nacional instituciones tanto públicas y privadas, instituciones de salud y también empresas que hacen aporte y apoyan con su parte tecnológica a los establecimientos de salud, ¿no? Y bien. Ha sido un esfuerzo bien grande, ya le vamos a comentar cómo ha sido y les invitamos a que puedan ver todos los avances que tenemos y más bien agradecidos porque estamos trabajando en conjunto y invitarles también que a los demás países que se animen y vamos avanzando en este tema de las conectadones. La región está avanzando, internamente también estamos armando nuestra ruta nacional, por ponerle un nombre así. Muy bien, gracias a todos, gracias por la oportunidad.
Excelente, José, gracias. Muy bien, y ya nos vemos allá en Lima la otra semana.
Muchas gracias, José Luis, por compartir también tu experiencia. Espero que podamos también después puedan compartir los resultados y bueno, los podríamos estar eventualmente también ahí mostrando a toda la comunidad. Muchas gracias a todos los asistentes. Recuerden, nos vemos la próxima semana. La próxima sesión es la próxima semana. La vamos a estar conduciendo con nuestro equipo de desarrollo y tiene relación con, es un poco más en formato taller. Vamos a mostrar este paso a paso del proceso de onboarding asociado a las llaves. Probablemente generemos también una llave autofirmada. Vamos a tratar de hacerlo lo más didáctico y paso a paso posible para que vean cómo es ese proceso y por supuesto que sirva también el material para después con sus monitores, quienes están en este camino a la Conectatón, repetir este proceso, actualizar las llaves y también asegurarnos que las llaves que hoy están, hay muchos países que tienen sus llaves desde el año pasado, queden actualizadas y nos sirvan para la Conectatón de octubre de este año. Muchas gracias por su asistencia y yo les debo la grabación de la sesión anterior y de esta van a quedar lo antes posible actualizadas en el canal de YouTube de Raxel. Nos estamos viendo. Cuídense mucho. Bye bye.
Chao.